Hey everyone, my name is Darshan Kulkarni, and I'm your host for the Darshan Talks podcast. As some of you know, I'm an attorney, I'm a pharmacist, and I advise companies with FDA regulated products. So if you work or have an interest in FDA regulated companies or their products, this is the podcast for you. If you are working in an FDA regulated company or are interested in the products associated with it, you're probably dealing with something that has had medical writers' fingers all over it. And if their fingers have been all over it, is because they've probably been through a lot of school, and to get there, they may have been through Danny's guidance. So you should care about today's podcast because our guest is someone who has spent a lot of time educating students. I believe it's over 22 years of distance learning, 16 years of online teaching. But we'll talk about that more. Please leave a comment and subscribe if you find this interesting. We'd love to have you listen to the next podcast. But Danny himself is currently the director of biomedical writing programs. He's the professor of biomedical writing. He has a PhD in biology and has a decade at Wyeth where he worked on 14 NDAs. He's now at the University of the Sciences where he redesigned the curriculum for the biomedical writing program, significantly contributed to the creation of a graduate program in regulatory sciences, and created or revised 12 courses. He's been the instructor of 10 regularly occurring courses and 7 special topics courses, many of which have been taught multiple times. He's the author or co-author of 14 manuscripts, 2 book chapters, and numerous clinical reports. He's been on 9 professional society meeting program committees. Danny, what did I miss?
It's now 4 book chapters because we have a second edition and significantly revised those 2. So they really aren't the same thing anymore since quite a bit happened between version 1 and version 2. I have other manuscripts in the hopper. We'll see what happens. But that's part of course, being a professor. It's not just publish or perish. It's publish because that's what we're supposed to do.
Yeah. Ladies and gentlemen, our guest for the day, Dan Benau. Danny, again, thank you for coming on. I appreciate it.
Thanks for having me.
So let's ask some basic questions, right? Why did you decide to go from being in Wyeth, working on NDAs, to being a professor?
Well, actually, I worked at Wyeth for a decade. I moved on from there. I was at Sanofi Cintalabo for a bit over a year, and then decided to go freelance.
Okay.
So I freelanced. We kind of set an industry record before I left freelancing. I was hired at the beginning of October, and we submitted an NDA in the middle of December.
Wow. That's 2 months, right?
Yeah. 2.5 months, and that product ultimately went to market.
Which one was it? Do you know? I mean,
excuse me.
Which product was it?
It was called Vantes. It was a treatment for advanced prostate cancer. Used histrelin, which was an off-patent drug that was originally used to treat precocious puberty, but they wrapped it up in the material that was, so it was a combo product. It was wrapped up in a tube made out of the material from gas permeable contact lenses and was then implanted under the skin. So it was good for a year in treating metastatic prostate cancer.
Okay, so your biology knowledge is not skin deep, if you will. Obviously, you have a PhD.
Yeah, actually, just of interest to anybody, my in terms of history and pedigree, my dissertation advisor, Charles Turner, himself had been a graduate student of Sir Hans Krebs, as in the Krebs cycle.
Wow.
And I met that guy a couple of times.
That's kind of cool.
Yeah.
I remember trying to memorize the Krebs cycle. So I'm not sure if I like him or hate him. But
We had to be able to do it if we were in our sleep. We had to be able to wake up and go through the whole thing.
I can
Don't
tell you
ask
right
me now,
now,
though, please.
glucose 6-phosphate gives you fructose 6-phosphate, gives you fructose 1,6
That's
diphosphate.
glycolysis.
Is that glycolysis? Holy crap! That's been so far.
Citrate, isocitrate.
Oh God. Flashbacks.
Let's not bore the audience with this
Yeah,
one.
let's not bore the audience. Sorry about that, guys. So let's talk a little bit, Danny. When we were talking about, sorry, I can't believe I got glycolysis and Krebs cycle mixed up. But so you were talking about your history. You're talking about how you were coming. You started with Wyeth. You went to Sanofi. You started doing a little bit of freelancing. What happened then?
Somebody actually, it was kind of funny. I went to a Drug Information Association annual meeting, something I hadn't been able to do because Wyeth at the time had cut down on where we were allowed to go. And Sanofi, for the time I was there, we were only allowed to go locally. So I treated myself when I went freelance. And I happened to run into the booth in the exhibit hall of the University. The Sciences had a booth. And I just started talking. He said, "Well, you're a medical writer?" I said, "Yeah, we have a master's in medical writing program." And I went, "Really?" He said, "Yeah." He said, "Give me your resume." So I did. And it turned out the director at the time and I had postdoced. She had been the outgoing postdoc when I was the incoming postdoc.
Ah, did not know.
And so she kind of looked at it and says, "I know this idiot." And the next thing I knew, I was an adjunct. Then one of the full-timers left, and she said, "Well, you know what? How would you like to become a full-time faculty?" And I said, "You know what? Make a nice change." I'd already lost track. 14 NDAs is an awful lot of effort. I, to this day, have no idea how many clinical study reports I wrote. I was doing at least 5 or 6 phase 3 or 4 a year at Wyeth. Other phase 1, 2 clinical study reports, of course, the 14 NDAs. That included all kinds of regulatory documentation, overseas responses, MAAs. I just got tired of producing documents. At the same time, it's lucrative. It was, still is. And I felt like giving back to the industry. It gave me a chance to do something else. I had already gotten tired. I had 18 years at the bench, as a bench scientist before I became a medical writer. And so I transitioned into teaching medical writing. The director there left a year and a half after I joined U Sciences. And first I was interim director of the program, then I was confirmed as the director. I'm the 4th director in the program. I've been there. This is now my 13th year, which means that I have been director longer than my 3 predecessors combined. Also, just to note, I'm one of the few people who has been a full-time online professor. I even gave a talk about that in 2006 at one of the Lilly conferences on college teaching, because it was really unusual at the time to have anybody teaching anything online. And full-time at the time, I was teaching 45 credits a year online, which was too much. I ultimately had to say, I can't do this anymore. I would get the week between Christmas and New Year to crash, which is unsustainable. But I'm really happy with the way our program and myself have been able to affect people's lives. We did a survey back in 2017. This was part of a university survey, not just me, not just a personal thing. And as it turned out, 80% of our graduates were still in the business at the time. And over half of those were either senior writers or above, including at the time 4 who were directors or senior directors. And we had most of the others were successful freelance writers, either individually or they had their own business with people working under them as well. So we
So
really did have an effect on people's lives,
yeah.
and we're out there. We're a well-known program. I get plenty of calls. I get recruiter calls. I get calls to see if we have students who are interested in experiential work. So
So that's the question, Danny. Who is the right student to become or right person to become a medical writer?
it's funny because there are really three genres of medical writing. Okay, I came out, if I had 14 NDAs and clinical study reports that I no longer know how many, that makes me a regulatory writer. That's one of the three major genres. The second genre is promotional. Now, when you say promotional, people immediately think of medical advertising, and that is part of promotional, actually, a small part in terms of medical writing. Much greater is manuscript writing. The regulatory agencies consider any manuscript about an identifiable drug product is indeed promotional. So, you know, this is not legal advice. This is just a fact of life. Um, and then finally, there's education, and that's branded and unbranded. Branded would be continuing medical education, any of the accredited continuing clinical type educations. And then, other than that, there is patient education. So there's monographs, instructions on how to do stuff, and for the patient, what to take, how to take it. And these take somewhat different personalities. Regulatory writing is possibly, in terms of actual writing, the most boring writing task on earth, because it's very formulaic. What makes it interesting is that you're taking input from a number of different people, a number of different specialties, and putting it all into one single document that has to look like it's had one author. So it's the mediation, negotiation, occasional psychiatric practice in order to do that. Then there's promotional stuff and education. Really, these are the people who have the more creative writing tasks. Okay, they still have to adhere to drug label in order to do this. You can't go and just sort of write anything you want. It has to be stuff that's, stuff that is. Sorry about the dog barking in the background. He always seems to have to join.
That's okay.
But it still has to conform to clinical research results and what's on the drug label in some way, shape, or form. They can't just go out and say, okay, this and this happened, then a miracle occurs, buy the drug. It doesn't work that way. And in fact, even medical advertisement is far more highly regulated than people realize. There are TV ads that have created billion with a B dollar fines because they did stuff that really the FDA didn't want done, or other regulatory agencies. Actually, the United States and New Zealand are the only two countries that allow direct-to-consumer advertising of drugs and devices. So at any rate, those are the three genres, and they take different kind of people who are willing to do it. Probably the promotion area is the most creative, okay, especially when you get to the advertising stuff. In terms of in between, that would be the education. You're putting together educational content, but it's usually agency work. You may freelance, but you work for an agency. And the stuff that you're doing there cannot be branded if it's continuing ed. It has to meet accrediting specifications in order to be useful for getting credit. And so it takes a little bit of from each side, understanding the regulations and what those are about, and at the same time, creating engaging content, frequently under the direction of higher level course developers. Patient ed stuff, it can be, again, now the big thing is medication guides. That was never really given a formal format, but now they're kind of falling into place. And going back to where there is a certain amount of creativity in the regulatory field, the original target audience for any regulatory documentation were prescribers and regulators. But increasingly, the patient themselves are the target audience as well. There's a market for people who can translate clinical into English that's understandable, or language that's understandable. In Europe, they call it lay language because that's international English. It doesn't have the religious connotation that it does in the US. Here, we tend to call it more plain language summaries and whatever. So it takes different kind of head for each of those. You have to be willing to lead from below as a regulatory writer. But you still have to know your stuff, and you have to be able to deal with timelines, people who don't necessarily want to meet their deadlines and will take a bite out of yours, and other stuff in terms of promotion. Again, deadlines. All medical writing is deadline driven. Okay, it's not a leisure activity.
Absolutely.
It's always been quite stressful. The stress comes bigger and smaller as time goes on, but there's always that stress. The clock is always ticking. There was one of the metrics, getting kind of old now, but it came out of the Tufts Development Center, which basically said that every lost day of bringing a drug to market is $1 million in opportunity cost out the window. So, having a writer fumble that deadline can be damn expensive.
Yeah. I think the number is now up to like 2.5 million or something. Probably.
As I said, that's the one I can actually put a reference to if I had to go scrambling for it.
So here's the next question. So you've done a bunch of stuff around telelearning, and over the last year, that's obviously become extremely important. What are some tips that you'd give to companies as they become more remote on how they can train their staff, including the medical writers, but via the medical writers?
Okay, I mean, a lot of it you just sort of learn by doing. So you have people who may shadow and give minor contributions at the beginning, and as they gain confidence and experience, they move on. But now, and these were not available when I started back in 1990, there are certificate programs all over the place. Some of them given by universities. A lot of them are not part of the accredited area of universities, but they're still valid certificates with good training. There are professional society certificates. By the way, be aware that there's a big difference between a certificate and certification. For instance, the only real true certification in medical writing, there are others in medical editing and so forth, but medical writing is the MWC, which is an independent, the medical writer certification, which is given by an independent group, but is administered generally through American Medical Writers Association and partly through Drug Information Association. So, and that's a credential. You can't even take the test unless you've had at least a year, been an active medical writer for a year. Whereas if I'm to take any of the certificates, some have more assessment than others. The ones that have no real assessment, I always call an I was there certificate. Okay, because you was there and you have a certificate, but nobody knows how much you slept.
Fair enough. Fair enough.
One of the things about degrees and stuff that comes out of universities is we have to have outside assessment. If it's an accredited university, then somebody is watching what they're teaching, how they're teaching it, and how they're assessing student progress. There's less so from a professional society and from some of these private organizations, maybe none, unless it's something like continuing ed, where there is an accrediting agency.
Fascinating.
So that's quality control in education and training.
Fair enough. Danny, as you know, we usually just aim for 15 to 20 minutes. We're already over because you're just interesting and you're a wealth of information. But we're going to do a new segment we're doing now, which is rapid fire questions. I'm going to ask you 10 questions, and you just answer them very quickly. Okay. What is an accomplishment you're most proud of?
14 NDAs.
Okay. Who is your hero or heroine and why?
My hero? I actually have a lot. My true ultimate hero is George Washington. Why?
Okay. Why?
He's the man who could have been king and said, no, thank you.
Very cool. What is your favorite way to give back to your community?
Teaching. I love teaching. Sometimes you get poor doing it, but it's worth it.
How do you define success?
Success is success is defined by when you affect other people's lives positively. Okay. I think that's important. It might be part of my religious background, I'm not sure, but if you have boosted other people in the world, you can consider yourself a success.
There you go. What challenges you?
What challenges me? Keeping the edge, being able to say I'm up to date and I know what's going on. By the way, part of that was and has been as director, I went to 5 professional meetings a year just to stay abreast of what was going on. 4 out of those 5 I paid for out of my own pocket.
Oh my God, really? Wow. Okay. What is your favorite movie?
My favorite movie? Boy. My favorite all-time movie. The original Magnificent Seven.
Okay.
The farmer always wins.
If you were a superhero, what would your power be?
If I were to be a superhero, what would my power be? Knowledge. Ultimate knowledge. There's a character in one of my, forgive me, but there's a character in one of the novel series that he knew everything, and he also had a hole through the space-time continuum in his knapsack that the other end was in a fruit warehouse. But the reason he had super knowledge was he found the scroll of ultimate knowledge. It had the answer to every question in the universe. And as he pointed out, when he finally admitted to having that, 2 things could happen. You go crazy and kill yourself, or you learn how to deal with it.
I guess he learned how to deal with it.
He learned how to deal with it. His other thing was he was a wizard, but he said there's no such thing as magic, just tricks.
Okay. If you won $1 million, what would you buy?
What, 1 million lottery tickets? I don't know.
You might end up owing some money on that one. If you could add a person to Mount Rushmore, who would it be and why?
Person to Mount Rushmore. Wow. They're all presidents, so.
I don't think
Franklin Roosevelt.
Your call, but
probably Franklin Roosevelt.
Okay. Why?
Because he took office in an incredible difficult time that got increasingly difficult as he went along and dealt with it. Was able to deal far longer than any other president, partly because of it was permitted, and partly because despite the fact that he was in a wheelchair, he had the stamina, the guts, and the willingness to do it.
Okay. Last question. Would you rather lead an easy life or an interesting life?
Let's see. Would you rather be indolent or suffer from a Chinese curse? Interesting. I've had an interesting life. I've never regretted getting my doctorate because I have used it now in 4 separate career directions. That would not have been nearly as possible if I didn't have it. I'm ever grateful. My real true hero, ultimate hero, actually was my dissertation advisor.
Oh, there you go. That's the URL.
He taught me so much. And I think of him every day of my life. And I use stuff that he taught me every day of my life. My father taught me a lot too. And he was, to me, he was my best friend.
Dr. Benau, I'm going to call up my legal card. You did not answer the question. Would you rather an easy life or an interesting life?
Interesting.
There you go. Okay.
And I have the interesting life to back it up.
Yes, you do. Yes, you do. Okay. So during this podcast, we talked a little bit about your history, about how you came to teaching, how you went from, basically bumped into University of the Sciences at DIA. You talked about 3 types of medical writing, the types of people who are right for them. You talked about the right student to become a good medical writer. We then did our rapid fire questions. And I thought that, again, while we didn't discuss anything that's legal or clinical advice, we had a good time doing it. But for those of you who missed it, Danny, where can you be reached? And, where can you be reached first?
I can be reached mainly still at the university.
Okay.
I have a university email address. And you want me to give it online or?
Yeah, sure.
Okay. It D.B as in boy, E, N as in northern, A-U, at usciences.edu.
There you go. And if you like this podcast, please leave a like or comment or subscribe. And you can find me at Darshan Talks on Twitter, or just go to our website at darshantalks.com. Thanks, everyone. Thanks for being a part of this, Danny.
Thank you so much again for having me.